Doctors of Reddit, what's the weirdest thing you have walked in on while a patient was waiting for you? Outpatient setting. Old timer hasn't seen a doctor in decades, if ever. I walked in and he was face down on the exam table, naked. He just thought that's how it was done. My mother-in-law was a doctor. One day I picked her up from work. She looked beaten down. I asked hard day, and she said, yeah. Was supposed to give a guy a physical. Walked into the exam room and he was masturbating. Not a doctor but a nurse. I once walked into my patient's room responding to his call light. He had an accident and peed on the floor on the way to the bathroom and was now laying in bed stark naked calling for me. His wife, I guess oblivious to all this, was just dancing in the pee, like eyes closed, hands over her head, hips swaying, in a puddle of her husband's pee. They were really a bizarre couple. Not a doctor but I was locked in a room to wait for mine. Was waiting a while and my youngest son was dancing so I get up and dance with him. I started teaching him this ridiculous dance move, bobbing up and down, bum pushed out and waving my arm behind like a tail while going woo woo woo. Doctor walks in at this moment with me doing that and my son mimicking. He just pissed himself laughing saying it was the weirdest duckin' thing he's ever walked in on. I heard this story on a local radio morning show many years ago. A woman had a gynecologist appointment one afternoon. Before leaving home she used a little feminine deodorant spray, just in case. She gets to her appointment and is assisted into the stirrups for her pelvic exam. The doc takes a quick look and says, "My, aren't we fancy today?" She had not used her feminine deodorant spray. She had instead accidentally used her daughter's glitter hairspray. Not a doctor yet but this was told to us by one of our nephrology lecturers. The patient is a small child with a worried mother. Kid presents with gross hematuria. Multiple samples collected. Imaging and physical show nothing wrong. However, urine samples are very alarming. Before moving on to invasive procedures, the nephrologist figures something's ducky. Long story short, he catches the mother pricking her finger with a needle and bleeding into the sample. The kid's okay but the mother is diagnosed with Munchausen syndrome by proxy. I'm just graduating med school right now. I was doing an ED elective and we had an older woman come in. She had dementia or something and had been found by a neighbor unconscious on the floor. She was severely dehydrated and had some electrolyte imbalances that we needed to fix. That wasn't the weird part. The weird part was that she was covered, head to toe, in thick globs of ketchup. The paramedics almost took her to a different hospital with trauma surgeons because they thought it must be blood. In hindsight, I should have stayed longer to ask what happened when she came to. I always knock, so nothing. They always come in just as I have found the one article in a magazine I want to read. A female withdrawing from heroin masturbating who told me that rubbing my clit and coming is the only way I feel better. She then had an orgasm. Not doctor but was waiting for patients to get changed into gown. Knocked to see if he was ready. When he said come in I opened the door to him sitting very casually, naked, with his gown wrapped around his head. I know the gowns can be a little confusing but really. Was an anesthesia resident at the time on an obstetrics rotation. A patient had just arrived in labor and I walked into her room to see if she would like an epidural. Apparently however she had come up with her own form of pain management as determined that masturbating furiously during a contraction alleviated her pain. Not a doctor but used to be security for a local hospital. Responded to a 381 mental wellness hold, dropped off by the local police department. Imagine walking into a room and being greeted by a naked and bloody 6 feet flying quetip of a man screaming, "I will not calm down until you all go home and masturbate. Don't do drugs, kids." Patient here. Was waiting 2 hours for the doctor in the room with my daughter. Doc had to run to the hospital and it took forever to get in with this guy so we stuck it out. This was pre-phone days so we had to entertain ourselves. So we made a balloon with a surgical glove. The doctor burst in at some point, clearly exhausted, as we are batting the glove around. Capital I, without thinking blurred, "Oh, you're here. Pizza will be here any minute." He was not amused. Redditors are more likely to be the patients doing weird it than be the doctors. Veterinarian here walked in on a client tasting her dog's vomit because she wondered what the dog had eaten. It was extremely hard to keep a straight face. In the ED, 2 guys just scored and accidentally injected whatever substance they scored into their wrist instead of their vein and came in to get checked out. Walk on, and the guy without drugs in his wrist is giving the patient a hand job. In their defense, they were high as it. I just operated for 5 hours straight, so I was tired and cranky. I went to check on another patient of mine after I was done in theaters. Walked into the patient's IQ room and found him being harassed by a couple of Jehovah's Witnesses who wanted him to join them. Completely lost my it on the spot. I don't know about doctors, but I had a doctor's appointment one day and stopped at the liquor store on the way to buy a Texas McKeev vodka. Doctor comes in and sees it and said, "OMG, what are you doing with that?" Me, "What? It's a long weekend." DR, "How long will that take you to drink?" Me, "Maybe a few days." DR, "What?" Me, "Don't worry, not consecutive days." DR, sigh. Not a doctor, but medical student. Was on my peds rotation this year and we were rounding on this 16-ish-year-old guy who was in for a bunch of non-specific non-serious stuff that his helicopter mom thought was very bad. Anyway, he was laying in bed with his pregnant, by another man, girlfriend. His mom was also in the room. Not exceptionally weird, just quite uncomfortable. I don't have the doctor pod, but I was worried I wasn't wearing underwear once and I knew I would need to strip down, so I tried to pull my pants from my waist but they were too tight, so I had to undo my belt and unbutton and unzip the fly a bit to check, and then as I was zipping back up the doctor came in. So while we were having our initial discussion I was awkwardly slowly zipping my pants back up inconspicuously. I imagine from his pov he thought I was either jerking off and he had caught me or I had a thing for him. I actually switched doctors so I wouldn't have to go back there. ER tech. Patient comes in for recent vomiting. I hear him gagging. Go check on him. He's sticking his finger down his throat trying to make himself vomit. I was the patient. Sorry, my doctor apparently forgot that I was in an examination room. I was waiting for an hour. He walked in while I was taking a picture of a painting of dogs on the wall. A colleague of mine who is also a resident in pediatrics walked in on his patient's parents having sex while he was awake in the hospital bed next to them. At least he was a toddler and maybe didn't know what was going on. I have walked in on a patient injecting her IV with heroin. I have walked in on a patient not 10 hours after delivery getting oral from her boyfriend, not baby daddy. I have walked in on a man watching porn on the hospital TV via an HDMI hookup. Postpartum RN here. I walked in on a patient and her husband having sex. She was less than 24 hours post-delivery. Let me remind you that when a woman has a veal delivery her hoo-ha dilates to 10 centimeters, and most often than not can't air and needs repairs. How that felt good for either party completely boggles my mind. My pediatrician to this day, except that I'd be too old now, gives my mom weird looks every single time they interact because as a toddler I farted on a plastic chair so loud when he came in it would only have to be my mother. Also, some poor doctor walked in to find I had the gown on backwards. I thought it was like a coat. Clearly I spent minimal amount of times in hospitals. IQ nurse here, walked in on a patient and his girlfriend in a heated argument about something. She stormed out of the room and turned on her heels just as she got to the exit to angrily say, "By the way, you should check out his teddy bear." Confused and intrigued, we confiscated his toy bear only to find it stuffed with a bunch of opioid pills he had been stashing. Turns out he was a small-time drug dealer. Not the doctor. I do feel bad for the doctor who walked into the ER room to find my dad with his gown on backwards and a sterile glove over his head being inflated by his nose. ER doc. Open curtain on emergency room bay and found girlfriend of very sick, pneumonia, patient trying to have a sex with him. He was telling her to stop. Awkward and a bit rappy. 16-year-old psyche patient and lingerie lying on the examination bed asking for a breast exam. She asked me to lock the door because she was nervous someone would walk in during the examination. I ran for my life. So much trouble brewing right there. Honestly, I feel like most of this thread is Americans. I have never been in a room alone for the doctor to just walk in. She is either in the room or stood outside the room talking to a nurse, and all the doors are open if no patient is inside, as it's a policy. So what country has put you in a room alone? Not a doctor. I went to the gynno once and was as usual overly nervous. When she told me to change into the paper gown, I immediately pulled my shirt and bra off before she could got the chance to tell me she'd be back in a few minutes. She had intended to leave the room while I changed. Seems so obvious in hindsight. I've told this story before, but I had a patient in the ICU after an aneurysmal subarachnoid hemorrhage who we would always find with different shady friends in his room. Found out from his sweet 80-something-year-old mother a few days in that those friends were actually the middlemen for his meth lord empire. He was brokering meth deals from his ICU bed. I'm late as it, and not a doctor but a nurse. I overheard a PT talking over the call remote thing we have. So I just gave a quick knock and entered. His girl was literally on her knees giving him a BJ. Duck and awkward. He pulled up his blanket and she tried to play it off. I didn't apologize and just kept eye contact with him, trying to act like I didn't know what was going on. Doctor here. Once walked in to see a lady who needed a breast exam. She was in her 80s. Glanced up from her 50 Shades of Grey book when I opened the door and gave me a smile that made me shudder.